First and foremost, hello! My name is Allie, and I've been on Accutane for about 16 days, so just about 2 weeks. I wanted to start this blog and these videos as a way to document my progress through Accutane, and also as a way to be of help to people, because my dermatologist has told me a couple times that a lot of his patients have a really hard time getting on the drug because of the confusion with the iPledge program. And this is because of the process that it takes for you to even be able to start the drug. If you don't already know, the iPledge program is a program that ensures that there's absolutely no pregnancy in people who are able to get pregnant during the course of isotretinoin treatment. You get a booklet entitled Isotretinoin Educational Kit for Female Patients Who Can Get Pregnant by the iPledge program. And you have to sign paperwork, you have to go get tests done, and it can be really, really hard to follow. So I wanted to help you out with a video that breaks down the iPledge program in regards to getting started on Accutane or Clarivis or just isotretinoin in general. So get your planners out, let's go. First things first, decide that you want to go on Accutane or talk to a dermatologist who recommended it. Either way, you're going to be seeing a dermatologist. That first day that they decide that you should go on isotretinoin, they'll give you this booklet with a bunch of paperwork inside, and you'll have to sign a lot of papers, stuff like this, and you'll get the little receipts. So that'll be all taken care of, and they'll probably give you a timeline. You need to have 2 negative pregnancy tests before you start isotretinoin. You can take the first pregnancy test as like a dipstick, just with like a urine test with your dermatologist that day, but then here's the tricky part. You have to wait 30 days or until your next period to take the second pregnancy test. Like in my case, my next period was the week after I took the first pregnancy test, and I got my blood work done. But then I found out there has to be a 30-day window between the first and second pregnancy tests. So even if your period comes before that 30-day window, you still have to wait the 30 days until your next period to take the next pregnancy test because it has to cycle around that. In the meantime, you're going to have to set up an appointment with some kind of contraceptive counselor. For me, it was a gynecologist, nurse practitioner. Basically, you give them this booklet. There's a section in it that you go over together, the birth control section, and you have to fill out paperwork together, and you choose your 2 effective forms of birth control because you have to be on them through the entire course of your isotretinoin treatment. In addition to being on them during the treatment, you have to be on them for 1 month before starting and 1 month after starting. Once you've chosen these methods, your doctor will note your 2 forms of birth control on your account in iPledgeprogram.com. Also, during this time of waiting for your next pregnancy test, you can be checking with your insurance company to see if you need a prior authorization to retrieve and pick up your prescription for Accutane or Clarivis or whatever brand you're taking. Because a lot of times, insurance companies want to see that you've tried everything else before you go on this due to the side effects. Once the 30 days has passed and your period has come around, you're almost there. Schedule your blood work appointment for your serum pregnancy test. You'll also be getting a few other tests that you need to get the month before you start the drug, the first month that you're on isotretinoin, and the second month that you're on isotretinoin. You get me. Your dermatologist will have written you a prescription for all of these blood tests. You'll then give them to the blood bank. You have to get used to blood work because you're going to be getting it every month for the next 5 or 6 months. Now you are seriously in the home stretch to starting Accutane. Once your blood work results get into your dermatologist, schedule an appointment with your dermatologist ASAP. Then, when you get there, you will finally have the holy grail, your Accutane prescription. You have to ask your dermatologist in which order they entered your forms of birth control into the account in iPledgeprogram.com, because every month you have to fill out comprehensive questions on that website before you can pick up your prescription. After leaving the dermatologist with your beautiful prescription in hand, go home, sign on to iPledgeprogram.com, and log in. You have to take the comprehensive quiz and make sure that you enter the 2 forms of birth control in the same order that your doctor entered them into the system. Otherwise, it'll kick you out and you'll have to wait another 30 days. Next, go give your prescription to the pharmacy and wait. If you need to get prior authorization from your insurance company, they'll notify you when it went through, and then you'll have to make sure you can go pick it up before that 7-day window closes. If not, just wait for the prescription to get there and you'll be golden. But remember that you will always have 7 days from the day that you got your blood work until you can pick up your prescription. It's not 7 days from the day that you had your dermatologist appointment. So make sure you act fast and don't get lazy on planning. With my dermatologist, when I started, we made 5 next appointments so that we know when I'll be coming back, and I'll schedule my blood work for 2 days before those appointments. So I hope I explained that kind of okay. If anybody has any questions, you're just getting ready to start Accutane, just let me know. I think I did a pretty good job of figuring it all out. At least my dermatologist told me that I got it done pretty quickly. Just as long as you are on top of everything and you write things out, and I have a whole folder dedicated to the iPledge program. As long as you're organized and you get it done, you'll be on your way to flawless skin in 6 months' time. So, good luck, happy Accutaning, and see you later. Bye!